Health and disease in the Victorian era. The spread of disease. Epidemics successfully spread diseases from country to country. When Europe would invade other areas, they would bring diseases that indigenous people were not immune to. Eventually, they would bring the new illness to their homes, infecting others there around. Tuberculosis, also referred to as consumption, is a potentially fatal microbacterial infection that affected the lungs in 1855. Symptoms included excessive coughing that could contain blood, fever, and weight loss. What seemed like a small illness at the time, tuberculosis became fatal when the disease would consume the organ it was attached to, most likely the lungs, which affected breathing. It was also easily spread through coughing or sneezing into the air around other individuals, leading them to contracting tuberculosis. Without close attention or treatment, the illness had a high death rate.
Smallpox. Although there was a vaccination invented in 1790 by Edward Jenner, smallpox still played a major role in the people of London's lives. In all of Europe, there were about 400,000 deaths per year and was the third cause for blindness. The painful effects of smallpox were excessive bleeding, diarrhea, high fever, vomiting, and small blisters covering the entire body. It is transmitted through direct physical contact with someone who is infected by the virus. With no actual cures the hospitals or doctors could give, cowpox, a weakened version of smallpox, was injected into the patient and depleted the original illness. Doctors and remedies. The British had some incredible health treatments for their time, but several became misguided in their theories or inventions. Common remedies were purging the body with laxatives, applying leeches to open wounds, amputation, air changing, better hygiene, surgery, and herbs. Most of the remedies were helpful, but fell short in many aspects. With little understanding about using the certain treatments with certain diseases, doctors would often misdiagnose their patients, providing the wrong treatment which could then lead to death. Probably the most important invention during this disease-ridden era were vaccinations. They helped mainly with preventing smallpox, cholera, and the common flu through injecting the serum into the body, giving it immunity to a number of diseases. Vaccinations lowered the death rate dramatically and caused the population to increase. Important individuals. There are hundreds of people who contributed to increasing the health in the Victorian era, but the main individuals and influences are John Snow, Filippo Passini, Louis Pasteur, and Edward Jenner. John Snow convinced England that the spread of cholera was through contaminated food and water in 1854. Filippo Passini was an anatomist who was famous for isolating the cholera bacterium in 1854 and eventually creating a vaccine against it 30 years later. In 1860, Louis Pasteur developed the germ theory of disease, where he and his assistant Robert Koch identified each disease-causing germs and developing treatments to get rid of or preventing them. Edward Jenner is famously known for creating the very first vaccine in 1796 for smallpox, which was very useful in the Victorian era.
Cholera. In 1832, London experienced one of the most violent diseases in the Victorian era, where sanitation was so poor and misunderstood that villages would throw their sewage and used diapers from their children into the main river, contaminating the water which was connected to the most used water pump in the village. Very few people were aware of the spread of this disease until John Snow discovered it. When the water or food containing the bacteria was consumed, symptoms such as severe diarrhea, vomiting, dehydration, and lethargy would occur before death in as short as 3 days, with a low survival rate.
Hygiene played a major role in deficient health during this period. There was little to no sanitation and differed between the rich and the poor. Lower-class villages were unaware of the spread of germs, as they often shared utensils, bathed only once a month, threw trash and sewage into the middle of the town or rivers, contaminating both the air and the water. There was also an increase in STDs among poor villages due to the higher number of prostitution. The upper class had better hygiene, but still not enough to stop the spread of disease and illness altogether. Indoor plumbing and running water were only available amongst the elite, which resulted in a majority of upper class and middle class people being subjected to the same conditions as the lower class.